today is give preterm babies a strong start. They are just arriving soon, but they are not weaker in any sense, though they are immature. As they rightly said, their learning is steep right from the beginning. So now I would like to tell how preterm babies are different from term babies. They need a lot of breast milk, love, you have already nailed that, and they also need some additional medical procedures, some few supplements in addition to the term babies. That's all that makes the difference. So what are they? How preterm milk, yes, I said milk makes a huge difference, right? How preterm milk is different from term baby's milk. Do you know the moment when you latch your baby and you start feeding your baby, it's not the same milk that a term baby's mother secretes from a preterm baby's mother. Preterm baby's milk is more in terms of protein to help boost the weight gain rapidly. It also has immune boosters like IgA and lactoferrin, which helps in fighting the respiratory infections. Somebody sneezes, it's somebody else's cold, but it can go down directly into the lungs of a preterm baby and become bronchiolitis. So IgA, the antibody, the policeman that fights the respiratory infections, is quite high in a preterm baby's milk. Also, DHA, the supplement that is required for brain growth, is in more quantities in preterm milk compared to a term baby's milk. So a lot of things are different, and it is tailor-made, custom-made. This is much better than AI. It is the best thing if you ask me. Then, a term baby directly latches to the mom and takes the milk, but a preterm baby might require feeding support in terms, just like how Rani has beautifully mentioned, that their reflexes are poor or slow, and we need to do oral water stimulation sometimes. We need to express and feed them either with a tube or with a syringe or gavage or palade and slowly take the journey forward. And they require more frequent weight checks than a term baby. Sometimes we also need to do milk fortification. Yes, preterm mothers are already giving that extra protein and a lot of stuff, but still we sometimes need to do what is called as human milk fortifier. HMF might be required to give that little bit of an extra weight gain to these babies, especially babies less than 34 weeks, babies who are weighing less than 1.5 grams, might get maximum benefit with HMF. And normal term baby requires only one supplement, that is vitamin D. Rest everything the baby makes it his or her own body. Most parents ask me, doctor, why don't you give us some drops to enhance the digestion? No, we don't need neopeptide drops or anything to boost digestion. Babies are naturally blessed with enough digestion. However, vitamin D is something that both term babies and preterm babies get. Other things that a preterm baby might require is iron, because around 6 to 8 weeks of age, these babies may have anemia of prematurity, and to combat that, we have to give a little bit more of iron. The lifespan of red blood cell is usually 120 days in an adult, 90 days in a normal term baby, and is much lesser, 70 to 80 days in a preterm baby. So we give a lot of iron, calcium and phosphorus only as and when required based on the baby's requirements, and sometimes multivitamins and DHA as well. Then, what are the other medical tests that these babies require? We know that hearing screen, thyroid screen and newborn screen for a lot of 50 plus diseases is required for both term and preterm babies. But preterm babies, in addition to them, require ROP. So what is ROP? Retinopathy of prematurity. So when babies are exposed to oxygen, sometimes oxygen can be good, oxygen can also be bad. As in, oxygen in its stable O2 form is required, but if oxygen in unstable free radical form can do a little bit of damage to the baby. So is there anything of that sort is something that we need to look at. So the retina is usually developing after 38 weeks-ish, the retina develops. So we keep looking at the retina, how is retina developing, is there any issue with the development of retina. So that is screening for retinopathy of prematurity. We screen them for echocardiography. We do a scan for the heart and we see if all the chambers are fine, if there are any open holes or any communications in the heart. And we do the bone mineralization test, which is nothing but the calcium, phosphorus and other stuff. And finally hip ultrasound, especially when there are twins, and if one of the twin is in breech position, we do scan for hips as well. So those are the things that a preterm baby requires in medicine. And finally, developmental follow-up. We meticulously follow up right from second and third month of life itself. We follow up these babies for development. And there is one additional vaccine that I would like to bring your attention to. As I said, somebody else's cold is a preterm baby's lung infection or chest infection called bronchiolitis. So somebody sneezes and then this RSV, respiratory syncytial virus, spreads across the air. Can we protect our babies against this sort of virus? Definitely, yes. We have two sorts of antibodies, ready-made antibodies, monoclonal antibody injections that we can give to the babies to protect the baby from RSV infection. One is palivizumab, which is kind of expensive, and the other one is nivolumab. Both are commercially available and we can you can utilize them. And coming to the success story that we have had of late is our twins sitting here. So we have had 34 plus 3-weeker twins here. Antenatally, I thank Dr. Radhika for giving us the opportunity to interact with the parents antenatally. It always helps meeting the parents antenatally. So, this is a huge decision, delivering the baby preterm. And usually parents have a lot of questions as well. So, talking through the anticipated complications well ahead, like there could be respiratory support requirement, infection, feed intolerance, and going through all of them again and again helps, because wrapping your head around all those complications in that rapid span of time is really difficult. So giving a tour of the NICU and catching up with the parents antenatally definitely helps establish a rapport and smooth transition postnatally. And I would like to say one thing, pediatric practice can be divided into before steroid and after steroid. Steroid has redefined and changed the course of pregnancies dramatically. So yeah, these are the two tiny heroes sitting here with us and celebrating World Pregnancy Day today with us. 1.70 and 1.775 grammars, 34 plus 3 weeker, isn't it? And the girl, usually girls are fighters. The girl required support for barely 2 days on HFNC and then stepped rapidly down to, CPAP for 2 days and then stepped down and weaned down to HFNC and then to room air. Boy required support for 4 days and then stepped down to HFNC. Both of them slowly, caught up on breast milk, and yeah, this is how, normally what we think is, oh, maybe they